Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5. I'm your host, Dr. Stephanie Duger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, more surprising topics around the psychology and development of babies from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Today, we'll be speaking with Dr. Raylene Phillips, the president of the Association for Prenatal and Perinatal Psychology and Health, otherwise known as APPPAH, and a neonatologist with a passion for the well-being of babies. After raising 3 children as a stay-at-home mother, she received a master's degree in developmental psychology, became certified as an infant development specialist, and then graduated from medical school at the University of California, Davis in 2004. Dr. Phillips completed her pediatric residency and neonatology fellowship at Loma Linda University Children's Hospital in Loma Linda, California, and is currently an attending neonatologist in the NICU at the same hospital, as well as medical director of newborn nursery at Loma Linda University Medical Center, Murrieta. Raylene is an international board-certified lactation consultant and is a fellow of the Academy of Breastfeeding Medicine. Her primary area of interest is supporting emotional connections between babies and their parent. Welcome back to Prepared for Parenthood. I'm so excited today to have Dr. Raylene Phillips with us. She is joining us from California, and I will let her share a little bit about her work with expectant and new parents and their little itty-bitty ones and what she does. Welcome, Raylene. I'm so happy to have you here.
Thank you, Stephanie. I'm really happy to see you again and also to be here to be a part of the work you're doing, which is really important. I'm a neonatologist who works with sick and premature babies in the neonatal intensive care unit or NICU, but I also have the honor and privilege to take care of well babies in a community hospital that has both a small level 2 NICU and then also well babies that are in couplet care with their mothers. So I train to take care of the sickest of the sick preterm babies down to 23 weeks gestation. And I can do that. That's what most neonatologists do, is work only with sick and premature babies. But at this hospital, I also get to take care of well babies, which I love doing. So kind of the best of both worlds here.
That's wonderful. So I wrote an article about the sacred hour, and I'm wondering if you could just share what that is for people and why it's so important.
Well, I'll give a little background. When I was doing my neonatology fellowship at Loma Linda University Children's Hospital, which is our 84-bed level 4 NICU, I would go to deliveries when the neonatal team was called. And if all was well, I would be sure myself to put the babies on mom's chest, skin to skin, and then I go back to the NICU. And what I found out from one of my OB friends, one of the OBGYNs, was that as soon as I left the room, the baby was taken off of mom's chest and put back on the warmer so the nurses could finish their checklist of, weigh the baby, do the footprints, the handprints, give the vitamin K, the erythromycin, or whatever else they were going to do in their first assessment. And then sometime during the first hour, the baby would be put back on mom's chest. But it was often interrupted. And there was no thought given to what was the purpose of that first hour? What all was going on during that first hour after birth? So what I realized is that there was a misunderstanding about what was really important in that first hour. So we created a task force at our hospital with our OB/GYN colleagues, both physicians and nurses, and also our neonatology colleagues. And it took about a year, but we realized we had to change the protocol of our postpartum care. And the things that were not absolutely necessary to do for well babies could be delayed until after the baby's birth breastfeeding. Because after birth, the newborn's physiology is completely changing from what it was in utero. The blood flow is different. Now, instead of avoiding the lungs, it's actually going to the lungs because the placenta is no longer present to provide oxygenation. And then the baby, of course, was in a warm environment, wet environment, and now they're in a cooler environment of the delivery room, and they've got to stay warm. And ideally, they get their warmth from mama's chest. Also, they're meeting their mother for the first time outside the womb. And mother's meeting her baby, who she has imagined and hopefully spoke to and sang to, but for the first time outside the womb. So, very beginnings of afterbirth bonding are taking place. And these are really important, but they aren't really highly valued or really even thought about by many in the medical world because they're not really prioritized. They're not talked about. So it's not that people don't care, it's just they don't really know and they aren't really aware. So our goal was to educate the labor and delivery nurses who were there at the time of birth and the doctors that this was a very special time. In fact, it's once in a lifetime experience to be born. And so we want them to treat it with respect and protect that special time. And so our group decided to call it the sacred hour. The first hour after birth for a trauma victim is called the golden hour. And so very preterm babies, we call it the golden hour, where a lot needs to be done to stabilize them for admission to the NICU. And in that first hour is really critical. You have to get off to a good start with these babies, keep them warm, them ventilated, and that sort of thing. So this is a special time too, this first hour after birth. And so we set it aside as a sacred time, something that is highly important, that is deserving of respect and protection. We compared it to a wedding, for example. Now, even if a wedding was a civil service with no religious connotation at all, we still recognize it as a very important event that's sacred for that couple, right? Pledging their life to each other. So we wouldn't interrupt it for just routine business. Only if something was wrong, say the bride or groom fainted, would we interrupt that wedding. So if something's wrong with the mother or the baby, of course we interrupt the sacred hour. But if not, we put them skin to skin immediately after birth, and we don't interrupt them until after the first dressing is complete. And then we do our routine cares. And one other thing we made everyone aware of is that all newborn babies, if they're skin to skin with their mothers, they know how to find the breast and latch on by themselves, just like every other mammal. In the animal world, there's no lactation consultants, and the mother doesn't initiate breastfeeding, the baby does. The baby finds the teat, the baby finds the nipple, and latches on. And in the human world, the baby will do the same thing. You've probably heard of the breast crawl, but there's actually 9 stages that babies go through, which are really fun to watch and identify if they're left uninterrupted. And so we instituted that practice in about 2011. I wrote the article in 2013, and we've continued to practice it through all those years now, over 10 years now. And wonderful parents, mothers love it. We even do it with C-section babies. In fact, we introduced it at Loma Linda with C-section babies, and at Marietta, it's always been that way. That's our community hospital, is Marietta Hospital. And I met a mother in the cafeteria one day, and she said, "You were at my baby's birth." I said, "Really?" He said, "Was it a C-section birth or was it a vaginal birth?" She said, "It was a C-section birth." And then I said, "Did you get to have your baby skin to skin right after your birth?" And she said, "Oh, yes." She said, "I didn't get the vaginal birth I wanted, but at least I got my baby immediately after birth, skin to skin." So it was a wonderful birth.
And you spoke about the physiological importance and the importance for the building of attachment right off the bat. And also, of course, we hope that's happening in the womb as well, the attachment process. But what are those 9 stages of the baby finding the breast after birth?
Well, they're kind of artificially defined, but it's still fun to look at it. So the first one is called the birth cry, and that's when the baby takes a breath. And usually, at least in the hospital setting, they often cry. Now, I've seen many videos of home births, especially water births, where the babies don't cry at all. They just take a breath and start breathing. And I imagine it probably has to do a little bit with the stress, quite a lot probably, with however the labor was and the stress of the mother. But nevertheless, it's the first breath, we could call it. And then there's where the babies lay on mother's breast is called a quiet time. When you put them skin to skin, they become very quiet, very still. It's kind of like when you think of the baby's perspective, think about being all curled up in a tight little ball, very constrained, but very secure in mother's womb. And then all of a sudden, and it's relatively quiet, and you only hear mother's talking from a distance, and you hear the heartbeat and the vowel sounds and everything. And then all of a sudden, you've gone through this tremendously tight little tunnel, and then you burst into this room with there's light and sound, and your arms and legs are flailing for the first time since you were very tiny. So it's a huge adjustment for babies. And if you're with your mother, at least you feel something familiar. You hear the heartbeat and that sort of thing. So after this quiet time, then there's kind of an awakening where the baby opens its eyes because it's bright. So the eyes are usually shut tight, and then they open their eyes and begin to look around. They aren't really moving much yet, just because they're kind of resting. And then they begin to move their upper body. So there's a little bit of activity here, and their arms are moving. And then they begin the crawling. So they push with their feet, and that's their lower body, and then push up towards the breast. And then there's sometimes a rest in between. So that's one of the stages. Then they find the nipple and they start familiarizing themselves. It's called the familiarization stage. They're kind of bouncing their mouth back and forth around the nipple, licking the nipple, tasting it, seeing how their tongue works in air and gravity, something they've never done before. This stage can take about 20 minutes. And that's when we usually try to get involved and say, oh, and let me help you. Let me help you. But they can do it themselves if you just give them a chance. And then all of a sudden, they just latch onto that nipple and go to suckling. And we call that suckling, of course. Then afterwards, there's a sleep where mom and baby, if they're allowed to, can have a nice deep sleep. So there's 9 of them, and they've got to be divided into their stages of activity.
Mhm. And when you see that, for example, after a C-section birth, does it look different for those babies than it does for the vaginally born baby?
Not at all. In the lecture that I give, I have pictures of twins, actually, that were 37-week twins, and they were placed skin to skin. Usually single babies we put across this way to begin with. And then when they get to the recovery room, we put them more vertical. But we put these babies both vertical, and they both went through exactly the same stages. Every baby does it. It's really fun to see. And they will go through those stages again for every time they're skin to skin, even after birth. Mothers didn't get that right at birth, they can sometimes get into a bathtub where the water's kind of shallow, or even just on a couch or a bed and lay a little bit on an angle or supine and put the baby skin to skin. Watch, they'll go through those same stages, and they'll do it until about 3 months of age, when the neocortex is mature enough to override the brainstem reflexes, because these are instinctive breastfeeding behaviors that are activated when babies are skin to skin.
It's so sweet. And what is the danger, Raylene, of if that gets interrupted? Sometimes it needs to get interrupted, as you said, if there's an emergent issue. And sometimes just out of lack of awareness, it gets interrupted. But what are the downsides of interrupting that time if it's not necessary, or even if it's necessary? And what do we do about that to help repair it?
So something is missed if that's not allowed. And I really believe that when mother and baby are separated after birth, there is an emotional wound that's created, because the mother and the baby are so primed to be together, to develop that post-birth or out of the womb bonding that hopefully began in the womb. And that emotional wound, like any wound, can be healed. It's not that it can't be. It's just that we need to be aware that there is a wound in order for us to repair it. It's like if you have a gash on your leg and you don't even see it, it never heals. Or at least it doesn't heal correctly. It may heal, but not heal in a way that is optimal. So I know this from my own birth experience, or my children. My firstborn was born. Now that I have some medical background, I understand he was born 3 weeks early, so he was right on the borderline of being a late preterm baby, and they just kept him in the nursery for 24 hours. They told me they just needed to observe him, and he was my first baby, so I didn't question it. And they said he was okay, wasn't in danger, and they brought him back to me 24 hours later. And at that time, it was like I'd already distanced myself from this baby that was in my womb, and he had been alone for 24 hours without his mother. And so he breastfed beautifully, which is very lucky because doesn't always happen. But I didn't feel a connection to him, but I didn't realize that it was lacking until my second and third babies were born. And then I recognized that there was something missing, some emotional connection missing. It was not that I loved him any less, because I loved him just as much, but there was a connection missing. And I really agonized over it for quite a few years. And then I found APPA, and I understood once I learned about how conscious and aware babies are and what a difference it makes if you are separated at birth. So then we were actually able to do some repair. I attend a workshop that taught me how to repair that missing first connection. And then I was able to also speak to my son about it. He was an adult. So it was actually, I don't believe, ever too late. Bonding and attachment can happen at any time of life. It's just easier the earlier it begins. The baby's brain is primed for learning trust. In fact, in the psychological world, that's the most important task of the first year. The most important psychological task is to learn trust. In the second year, the primary task is to begin to learn independence, which of course you don't have to teach. If you've ever been around toddlers, you know that. But you do have to teach trust. It isn't automatic. But the right hemisphere of our brains are dominant in the first year. And that's our social brains, our relationship brains. It's facial recognition, it's sensing safety or security. If we can use that time for optimal bonding, then it comes easy. It's just meant to be that way. It can be developed later. It's just more difficult.
I love that you were able to repair that early emotional wound with your son, even as he was an adult. I think so many of my clients come to me as adults and they're working on their very early own experience of being born or having separation from a parent when they were little. And I love just the whole premise that even if we miss it, most things can be repaired, right? At least to some degree.
And I also really firmly believe that the sooner we can explain things to the baby, the more we can minimize any trauma of separation. So in the NICU, when mothers and babies sometimes need to be separated or often need to be separated, if the mother or father can explain to the baby why they have to go or why they were separated, for some reason that we don't understand, babies get it. Probably not the words or the language, but the intent. They're very almost psychically in tune. They get the intent of what we're saying, the emotion of what we're saying. And later on in life, when they get language, they can also then put words to that intent. And we know that adults under hypnosis have memories of their birth, and they can put words to them. They can tell you who was there and what was said and what almost happened or what did happen. But whenever I am at the birth of a baby who is needing some resuscitation, I always talk to them and tell them what we're doing. Tell them I'm so sorry they're not with their mother right now, but someone's taking care of their mother and we're here to help them. And then as soon as we can, we'll get them together. And always I bring the father over or the partner. Say, here's your daddy. He's here with you. And when the baby hears their dad's voice, which they've heard before, you can just see them relax. And many times that's all they need to begin to breathe normally if they're having a trouble with their transition. So I always have the dads at the bedside with me when I'm working on a baby that needs some respiratory support or anything else.
And are you teaching the other doctors and the OBs and the nurses and everyone in your hospitals how to have these conversations with the baby? So, I mean, even going into a planned C-section, right? Where speaking to that baby and letting them know, hey, It's really important that we get you out right now. I think you do so much to create that repair before the trauma has even happened, right?
Exactly. I like to, whenever I'm doing an antenatal consultation, I encourage the mother to talk with the baby and let the baby know what's happening. I remember hearing about a father who during labor was talking to his baby and saying, okay, another power hug is coming,
Mm.
which is the
Oh,
way
that's sweet.
you're into contractions. But no, when I go to the birth of a baby, the first thing I say is, happy birthday, little one. Welcome to our world. We are here to help.
Mm.
And then more explanation as needed. And my nurses, they often they hear that and they talk to the babies too. And they also know if they bring a baby from the operating room to the NICU where I'm waiting for them, they bring the dad if they know that the dad is therapeutic. If mom can't be there, otherwise mom's therapeutic. They also know that if the baby is having just a slight bit of respiratory distress, maybe some fast breathing or a little bit of effort, that they put the baby skin to skin with mom. And they let me know this baby's doing a little bit of fast breathing, working a little hard, but they're okay if we put the baby skin to skin with mom and just watch and see if that improves. And I always say yes. And of course, I'll come to evaluate too. But often by the time I get there, the baby's doing great.
So, Raylene, you have such a unique role, right? So you are the president of the Association for Prenatal and Perinatal Psychology and Health, and you're a medical doctor who a neonatologist. And um, while I want to get into APPA in just a minute, I'm so curious, is there a program or has anything been designed to teach the medical professionals about the importance of having the sacred hour after birth, having the ongoing communication with this little one coming into the world, really helping to empower parents to show up in that way and connect with baby and support baby as they're making their way into the world, however that looks. Is there anything designed for the medical professionals specifically to get this super important work out there?
Actually, there's been a lot of interest in the sacred hour. And I have a lecture about the sacred hour that I have given probably 150, almost 200 times in many other countries other than the United States. And it's requested usually by the nursing staff, but they invite the doctors at the hospital to come to listen to it. And they are often very receptive to this concept because the first half of the lecture is about the role of attachment and bonding and the animal studies, thousands of animal studies that have documented the stress that baby animals and their mothers have when they are separated and how long term that damage is. I mean, it affects their weight gain, it affects their cortisol levels, it affects their brain development. And so it's something that if it's possible to avoid, to to give excellent medical care, we need to do so from a medical perspective. And then the second half is about how to safely institute skin to skin immediately after birth in the operating room and after vaginal birth with the pictures of the 9 stages. So it's a bit of why and then how to. And many hospitals have instituted the sacred hour based upon that presentation and also the article that I wrote. And there are other organizations that have chimed in and actually begun to do this as well. And it wasn't something that I necessarily started. In fact, just everything in my presentation is pulled from someone else. I didn't create any of this. I just put it together in a way that felt cohesive to me and compelling in a way that would hopefully inspire change. Also, APPA is working on education specifically for medical professionals, and it's about ready to do so. Our birth psychology month that's coming out in March, the theme is birth models that work. And so we're going to showcase birth models from all over the world that are incorporating these principles. And the recordings of those will also be made available. I mean, the month is free for anyone, but the recordings will be available for people to purchase and then show medical professionals in their hospitals of the different examples of birth models that really empower parents and also the baby itself. Because one of the things that I realized when I became a medical doctor, which I didn't actually do until much later in life, was that we focus almost entirely on the medical aspect of pregnancy and birth. And that's what I love about APPA is that we recognize the importance of the medical aspect. Obviously, that's our baseline. We must have safe births, but we also focus on the psychological impact of pregnancy and birth and the opportunities of supporting the psychological development of mothers and babies. Because when a baby's born, a mother's born too. And the changes in a mother's brain are actually observable on MRI from before birth and after birth. So the mother's psychological and mental health and the baby's psychological and mental health are at stake. And they need to be addressed. It's as important as the medical.
And does that also include the partner or father? Are there changes that are happening in that individual's brain and ability to connect and all of that as well?
Absolutely. There's a wonderful documentary on Netflix called Babies. I think it's like several parts. And it shows the changes in the MRI on both mother and father. And I know that when dads hold their baby skin to skin, which I always recommend to do in the first 24 hours after birth and daily afterwards for at least a month or two, the rise in oxytocin is measurable for dads as well as for mother. Oxytocin, of course, is our love hormone.
I love that. I wonder, have they also looked at siblings? So older siblings and the changes in their physiology as a new baby comes into the family?
No, I don't know that they have, but it's certainly something that would be very interesting to look at. It may have, but I just haven't, I'm not aware of it.
Me. You'll be so fascinated in that. Our older daughter was still is so maternal. She's 16 now, but she was so excited to have a little sister. And our kids are almost 5 years apart. And she just wanted to hold her little sister all the time and just snuggle in. And they have such a tight bond. They're really very much best friends, even with a larger age gap in there. So it's
I
very
have a
sweet.
beautiful picture of my two youngest grandsons when the baby was the youngest was there, and the oldest was 4 years older, and they're laying on the floor. They didn't know I was taking a picture, and he's just got his hand on his face. He just
Wow.
ate to his eye. He's just like so in love with this little baby. It's precious to see.
Oh, I love that. I love that. So you shared a little bit about pre and perinatal psychology and how it impacts maternal and infant outcomes. And if we skip that, if we don't hook into the importance of what's happening psychologically as well as biologically, what can happen? What are the downsides of not
There's a
doing
lot
that?
of study actually in the medical and psychological world about the role of stress and anxiety during pregnancy. And there's an increased awareness of the detrimental effects it has on both mother and baby, not just mother. I mean, they're very measurable. Some of the things that we know happen are there's an increased number of preterm births, increased number of low birth weight babies, high anxiety or stress can cause preeclampsia, just even gestational diabetes. And even the effects on the baby are becoming more and more measured and documented. One I thought was really interesting. Catherine Marth did a study that showed that if mothers had really high anxiety, that there was decreased cortical thickness in the developing brain of the baby. There's an increased risk of asthma and allergies and stress hyperresponsiveness and even difficult temperaments. And even because high cortisol, which comes along with high stress, interferes with immune system development, there's an increased risk of infant and childhood illnesses. So these are medical results of high anxiety. One thing I thought was really interesting is that in the study that Catherine Buck did, the biggest factor that separated the mothers with high anxiety from the mothers with lower anxiety or no anxiety was lack of social support. And it reminded me of a study I read about actually while I was in medical school It wasn't a study, it was a news report from Wisconsin that showed that in a particular county, it was isolated to a particular county, the preterm birth rate had dropped precipitously, and they had no explanation. They hadn't changed any of the obstetrical care. There was no difference in the availability of prenatal care. And what they discovered was that the only change was that in that county, they had got funding to send a social worker or a home health care provider to the home of every pregnant mom and to find out whether she had adequate housing, adequate food, and adequate support. And just the presence of that, somebody inquiring about their home security, food security, and social support dropped the preterm birth rate so precipitously that it was noted, and there was an investigation made as to why. So these things really are important. If the mother has chronic anxiety during pregnancy, and we're talking not just worried about this and that now and then, we're talking about really chronic high levels of anxiety, all of her anxiety and stress hormones are circulating through the baby. And the baby is programmed for the stressful world that the mother lives in. And so that's what they're expecting, is that stressful world. It's actually nature's way of helping the fetus to be prepared to live in that dangerous, presumably dangerous and stressful world. So it's understandable.
And how important do you feel like it is for parents to just understand a little bit about birth psychology and the impact that they can have on their developing baby? How does that help support that baby and that family?
Well, it empowers the mother to be able to make a really positive impact by knowing that if she is highly anxious, get some help for that. I think that because pregnancy is such an important period of life in preparing our next generation, supporting pregnant moms should be our highest priority. And we know that in other countries, they do prioritize the mother-baby relationship, beginning before birth with paid maternity leave during late pregnancy. Was just reading a study where they were talking about the importance of some mothers who were talking about how they realized they needed to slow down. This was actually on a Facebook group called Physician Moms Group. There's over 80,000 physician moms on this group, and they were talking about how many of them realized that they needed to slow down in the last part of pregnancy and not work up until the day of birth because the stress level made a difference in their baby. So these are working moms that were talking about the importance of creating just a little bit more space for peace and tranquility in their life. I also think, obviously, that it's important for the mother and the baby to connect on an emotional level before birth. Bonding and attachment are often thought of as beginning at birth. It can't start till after birth, when mother and baby meet face to face. But we know it can start even before birth, where mom and baby can have an emotional connection. They can communicate with each other, their movement and voice, and so that moms and babies feel like they already know each other. Mom feels like, oh, this is not a stranger. It's someone that I kind of know already. And it makes the early days after birth so much easier.
Absolutely. And so, as the president of APPAH, the Association of Prenatal and Perinatal Psychology and Health, can you let people know here how they can find out more about that organization and potentially get involved? How would they find you?
Well, our website is obviously www, but it's birthpsychology.com. Very easy to remember, birthpsychology.com. And there's a whole lot of information on our website about what our organization is about, what our mission and vision is, which is to provide birth psychology education for birth professionals and families from around the world. We are a global nonprofit organization. We have a really robust educational section with courses on every aspect of pregnancy and birth, and more being developed all the time. You could always email me at president@birthpsychology.com if you had a particular question. Happy to respond. We have an educational course that really is a one-of-a-kind course. It's called the Prenatal and Perinatal Educator Certificate Program. The 12-module course, I think that Stephanie has been involved in that, and many others from around the world. I think there's over about 600 graduates we have of it so far. But anybody who works with pregnant moms and babies would benefit from this very evidence-based, in-depth course about how to work with pregnant mom and babies before and after birth. Speaking of the need for social support for pregnant moms, we also have a new program that we've had for about a year now called Pregnancy Dialogue. And it trains facilitators to hold a small little social group for mothers and babies where we have a structured set of questions to just have a dialogue. Mothers, it's not a formal educational program for mothers. It's not birth education. It's just a place where mothers can get together with others who are having the same experience of being pregnant and just look at their own attachment with their family, their relationship with the baby's mother or the partner, and then also the developing relationship with their own baby. And we emphasize the connection that mothers can have with their babies in between sessions. So it's like a 6-week work group. Very easy to do. I've held one in my own home, and it was very gratifying and fun to do. So we have facilitator trainings for those, and then just standalone courses to give you more information about birth psychology and any aspect of it that you're interested in. But the most important thing that's coming up is our Birth Psychology Month that I mentioned. And every Monday, Wednesday, and Friday, we will have free presentations from around the world on birth models that work. And the recordings will be available for purchase if you want to keep them, but they are free every Monday, Wednesday, and Friday for the entire month of March.
That's so wonderful.
It's an amazing set of presenters.
And I'm really looking forward to diving into that and seeing the different models. Should be amazing. Well, thank you so much for being here, Raylene. I really just have so enjoyed our conversation and learned so much. And I hope that our listeners have also gotten so much out of your wisdom and experience with this particular topic and the sacred hour and learned about APPPAH. So thank you so much for being here and hope to speak with you again soon.
Thank you, Stephanie. It was a great joy to be here.
Take care.
Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.